So I'm a physical therapist. I specialize in treating folks with neurological conditions like stroke, spinal cord injury, and neurodegenerative conditions like MS, Parkinson's. And I also specialize in treating older adults, specifically health and wellness. So I thought, okay. It might happen, okay. So I thought I would kind of give you a driver of why I do what I do. And the title for this talk is inspired by something I hear every day from my patients. I'm too old for that, okay? Why older adults should strength train. Okay, so this is not just an issue of older adults. 80% of all adults do not get sufficient exercise, according to the American College of Sports Medicine. So as we get older, this can have some real consequences. So there are a lot of age-related changes to strength that we experience in the absence of exercise. Every decade past 30, we lose 10% of our strength. Okay, that's pretty significant. As a result, we also lose bone density. So our bone density tends to peak at 30 years and declines from there, again, in the absence of exercise. And part of the problem is that we go to a physical therapist, we go to a healthcare provider and say, I want to get started on exercise, I want to be healthier. You're either given not enough information, go do weight-bearing exercise, what does that mean, right? Or you go to a physical therapist or trainer who perceives you as frail because you're older and wears kid gloves when they're treating you, okay? So that's a big problem that I've seen in my own profession. The average age of individuals receiving physical therapy is 51 years. And if our profession is under-treating half or more of our patients, what does that do for public health and society? And this is kind of the worst stat that we have on the board. This is the bad news slide, okay? The rest of them are good news slides, okay? Leg strength is a top predictor of institutionalization, and muscle mass is a predictor of longevity. So institutionalization means you are forced to live somewhere other than home because you cannot get around by yourself. Leg strength is the #1 predictor of that. Strength training, and that's me and a patient doing some squats, okay? The good news is, and the rest of these slides are good news, no more doom and gloom, okay? There is no wrong time or place to start exercising. So the American College of Sports Medicine and others, American Heart Association, all these guys have rallied together and made these criteria, and they recommend 2 days a week of strength training. But let's say you've never done this before, you're brand new to exercise, it all seems very scary and nebulous. Even 5 minutes of exercise can result in a health benefit. 5 minutes, okay? And older adults can make the same physiological changes to their muscle and strength that a younger adult can. So if you start strength training, even if you're 70 years old, 80 years old, you start strength training, you can get stronger, you can build muscle, you can improve your bone density outside of medications, which is phenomenal. This is the stuff they don't tell you at the doctor's office, okay? On the right here, there's just a little snippet from the American College of Sports Medicine guidelines, where if you cannot meet those guidelines, do what you can. We need fewer barriers to exercise than more barriers. And the last point here, it's safe for almost everybody. There are a few special cases where strength training and general exercise is not safe without guidance from a healthcare professional. But overall, it's safe for pretty much everybody to get started. And this is a really fantastic paper. There are no wrong weights to lift. So if you feel like your 3-pound dumbbell isn't doing anything, it actually is, okay? Even a low intensity, meaning low weight strength training regimen improves things like gait speed, endurance with walking, and overall health. So you don't have to lift super heavy weights to get a health benefit. Okay. All right, this is kind of my philosophy. The best exercise program is one you're actually gonna do. So when I get a patient coming into the clinic, I try to figure out what they enjoy. If you are not seeking professional help for your exercise program, there's a lot of ways, especially in the community, that you can kind of find your niche, what you like to do. There's a lot of group classes available at places like West Hills, the Portage Senior Center, for example. You only have to be 50 to be a member, and they host a variety of exercise classes every single day. So you can kind of find things that you enjoy doing. You can go the classic route. I'll see you at the gym. We're going to go do some weights. You can do machines, free weights, it doesn't matter. The research shows functional improvements can be gained even if you're not doing the free weights, if you're doing the machines, which provide people a little more structure, and they're less scary because they kind of show you how to do the movement, which is kind of nice. Aquatics and pool exercises, underrated, but aquatics and pool exercises in the research are shown to be as effective as light lifting for maintaining bone density and muscle mass in older women, which is really cool. Body weight exercises, maybe you don't want to go to the gym, maybe the gym is scary. Push-ups on a countertop, squats, things like that that you can do in the home are effective. And lastly, just a little plug, trainers, physical therapists, and chiropractors that are experienced working with older adults can help guide you on the path to starting a strength training regimen. And I didn't mention, but YouTube, this is the NIH, they have a series of free videos to get you started. So maybe you start exercising and you're excited because you're getting stronger, but there's so many other benefits to it, if I have time. Great. Exercise is the #1 way to manage knee pain and low back pain. And that low back pain in particular, that's a Cochrane review. This is the creme de la creme of research. And that paper basically says it doesn't matter what exercise you do, as long as you move. Maybe you're going for a walk. Maybe you're hitting the weights at the gym. Maybe you're cycling. 5 seconds. Okay. Exercise is the best defense against falls. There's nothing better than exercise preventing a fall. And if you're doing strength training and improve your bone density, you are less likely to have an osteoporotic fracture, the incidence for which in women over 50 is 50%. Strength training is associated with gait speed improvements. Being able to walk fast requires bigger leg muscles. So if we're improving our leg strength, we can walk faster. And gait speed is one of our new vital signs. We use it in inpatient rehab and in physical therapy to predict how well someone's going to be able to get around in the community. So if someone can't walk very fast, we can say, well, you're going to have some trouble going to the mall or going shopping, or discharge from inpatient rehab to home, what you're going to be able to do. And lastly, I'm talking lots about muscle and bone health and strength, but there is a cardioprotective effect of strength training. The sweet spot is 82 minutes per week, reduces all-cause mortality for cardiovascular conditions. So I am on a mission to make the pursuit of strength accessible for everybody. Thank you.